So good evening, sir. Thank you so much for joining this session today. We are really honored to have you today. Some people actually dream and some attempt, but I think Dr. Atul is one of those people who actually make it happen. I've had the pleasure of knowing you, sir, since the time you have been with NABH, and I don't think I have even an iota of doubt to say that you have been the most go-to person, despite the fact that you handle a very difficult role and you are a public figure. I will not shy away from very confidently saying you have always been very approachable. You have always been very humble. You have actually helped us our viewpoint of how we look at an accreditation. And I would also like to add that you are one of those people who have never said no when it comes to anything that is being proposed in the interest of a patient. So thank you so much for being the person you are, sir. And with that, I would like to start with a fun question first with you. If you could kind of invent a completely useless but fun gadget for healthcare, what would that be according to you?
No, thank you, Gaurav. It's a real pleasure and a privilege to be on your podcast. And frankly speaking, you are very kind. But this is a service role which I am in currently, and NABH also. I think we have a very young team, very lean team, and they're all extremely service oriented. So though people may perceive us as a regulator, you know best that we are a true volunteer quality based organization. And coming to the fun question, yeah, that's a tricky one, but what one device we could create, right? Even I mean, taking cue from Doraemon, who has anywhere door and flying copters. I mean, that will be the Amrit Kalash or something, the elixir of life for healthcare. I mean, am I on right track, or what would you, or a
No,
quality
sir.
oriented?
That's completely fine, sir. I think that's a very interesting way of looking at it, actually. And though I have not been a very big fan of Doraemon, but I do have friends and people who have been fans of Doraemon. So
Or
thank you for.
Shinchan. No, there are so many learnings from Shinchan also we could take, right? And no, those things are to aspire to. And one day, probably all those gadgets will come true also, not very far in the future. I
That's
hope so, truly.
that's true, sir. That's true, sir. Sir, another one question for you. If hospitals were run by mythical creatures, which one do you think would actually be managing patient admissions?
Patient admissions are, as per Indian mythology, they're the Chitragupt, who keeps track of each deed and the karma comes back to. No, so yeah, I think Chitragupt ji will be the best suited to, whether.
Very, very well said and put, sir. Thank you so much for that. With that, sir, I would like to kind of focus on some of the key questions that we would like to hear out from you and maybe also learn a lot from you on that. Now, we do have accreditation frameworks, but how do you see these accreditation frameworks that integrate perspectives from technology, public health, and sociology to create a more inclusive and largely effective standards?
Yeah, so standards, the accreditation. You know that you are aware that NABH drafts and assess against its own standard.
Right.
Like for example, our colleagues from NABL, they follow the ISO, right? ISO 15189
Right.
or so many others, right? But NABH drafts and assesses, and just to give you a perspective of the 194, 195 odd countries in the world, only about 37, 38 countries have their own healthcare structure standard and are members of ISQA. This is
Right.
the exact number. So that means the 75% of the global countries, they do not have anything which is known as a structured, and India occupies a place of pride in such an ecosystem. For the past nearly nine, we are into the 19th year, NABH has kind of reshaped the ecosystem of healthcare. We are far away from perfect, but at least now there is a structured system of following healthcare, patient safety and healthcare quality, from where there was none. I mean, you know best, of course, being at Apollo Group, that Apollo was the cradle of quality. I can say that unhesitatingly. Apollo invited JCI, and JCI kind of triggered the government, and government kind of nudged the QCI into forming a board called NABH, and that's why the entire ecosystem. But that thing led to a real mushrooming of quality domain. Now we have quality professionals in each hospital, right? So that's a big credit to the government's wisdom, or to the focus on quality. Then the entire ecosystem conspires. You know, the payers angle, the insurance company, the IRDA, the health ministry. So I think it's a big movement which was all triggered, and which is existing and continuing and growing because of this butterfly effect of creation of NABH.
I completely agree with you, sir, actually. So I think just to add on what you said, NABH in itself has added a new job opportunity for so many people in healthcare.
Absolutely.
The quality as a subject has mushroomed, and every hospital is looking at quality healthcare, quality professionals. So again, thanks a lot to you and the complete NABH team for making this happen.
No, I'm too small, but our leaders
Uh,
are extremely active. Chairman QCI Quality Council of India has been nurtured by the likes of Sri Ratan Tata ji, Sri Venu Srinivasan, Sri Amitabh Kant, currently Mr. Jakshay Shah, prior to him Mr. Adil Zainul Bhai. All these people have brought something new, some new logic, some new guidance, some new direction, and they've really nurtured the organization. And we have not only now 5 boards, but whole lot of divisions, and end to it, hundreds of programs are running, from Swachh Sarvekshan to quality of coal to quality of fish, to absolute awards in the system, to geotagging, to drone policy, to cyber security. I mean, 2,000 people are colleagues at Quality Council of India. I think they're handling such diverse levels of expertise. The entire GEM portal, for example, 7 years they've been, the Z project, the MSME project. I mean, so the it's mind-boggling, the and then the Gunvatta Gurukul, the nurturing of youngsters, free of charge. So all those things are huge impact, and there's a with single line vision of creating quality in the DNA of every person, and to take quality to the last in the line. So that's the mission of QCI and all of our boards, like healthcare. But if it was not healthcare, if it was education like NABH, all of us are striving towards the same direction and goal.
Sure, sir. Thank you so much for sharing that vision and goals of QCI largely. So, what do you think are the interdisciplinary strategies that are most effective in bridging largely the urban and the rural healthcare gap? I mean, we do understand that there is still a gap, though there is a lot of work that has been happening, that has happened, but still there's a long way to go. But then, what are the interdisciplinary strategies you believe are most effective in largely bridging this gap?
Very right, Gaurav. So you also asked about the being inclusive, and this question also leads to that. That see, we are a big and diverse country compared to many other countries. We are not one country, but we are 36 countries. Like we are 28 state and 8
Right.
union territories, and each of them could be worthy of being labeled a small European country or a small African
Right.
country or so many others, right? And needs and diversity is very different, which we have recognized that one standard does not fit all. So today we are offering not one, not two, not 10, not 20, but 29 schemes or programs, each to suit the journey of a healthcare facility or a provider. And this diversity all culminates into generation of quality. Like we are having a flagship hospital accreditation program, which is comparable to the best in the world, which is benchmarking hospitals against the cutting edge. Any take JCI for example, take ACHS standards, which we really look up to and learn from them. But our India-centric, homegrown, Atmanirbhar, self-reliant standards, I believe, truly believe, are extremely similar to all these things, and they bring same level of competence, same level of traceability, objectivity, and transparency as any other nation in the world. But we also realized that our smaller colleagues in tier 2, tier 3, tier 5 cities also, very remote areas, they may not be ready to adopt all these very infra heavy, capex heavy standards for accreditation. So we drafted the entry level, not today, 2014, and we continue to raise the bar. See, basic tenets of accreditation is you should have a published standard and you should continue to raise the bar while having a peer review and while demonstrating continued quality improvement. So with that in mind, our entry level, we have very aptly, they have been named as HOPE, Hospital Online Platform for Entry Level Certification, completely transparent. So if a small hospital, let's say in a very remote district, can today aspire to be part of the quality movement at a very low cost. I mean, for price of a lunch in a decent place, we are offering 2 years of certification. And what this nudges the small hospital to do is that from where there was nothing, they are now at least following certain core standards. Not only following core standard, they are aware of the government schemes about the Ayushman Bharat PMJ, Pradhan Mantri Jan Arogya Yojana. They can aspire to be a part of the ABDM, Ayushman Bharat Digital Mission, because we have digital levels also. And just today we have released the our digital health standard for Hope hospitals also. So all this, what it has led to is that for accreditation, we have 2,500 plus hospitals, but for certification, we have now 13,000 hospitals, right? So otherwise, these 13,000 plus hospitals, and every month, at least 250 new hospitals are joining us, new hospitals. So this is the impact of the diversity and inclusivity of our standards. So hospitals which otherwise would have been devoid or deprived of availing the opportunity are aspiring and continuing, and not only aspiring, they're joining actively the quality movement which our leadership of the country, of the nation has envisaged.
I completely agree, sir. I think there is no second thoughts on how many hospitals or large, or rather how many lives we have actually touched through NABH, few directly and many, many indirectly, which actually, kind of comes out as outcomes, comes out as the overall safety that we have used as an arch over all the hospitals, clinics, or the other healthcare institutions. So I think the numbers that you have said are definitely mind boggling, but then the reach has been phenomenal, though definitely there is much more to do. But then I completely agree with you on that. So there is a lot of discussion that's been going on artificial intelligence, on automation. And I think even at NABH, we have been talking about digital health largely as far as digital health standards are concerned. But how do we look at, these specific areas of technology impacting and transforming accreditation and largely patient safety practices on the ground?
Very right, Gaurav. So we realize that, so we currently continue with the conventional model of assessments. We send out our assessors who are peer from the industry. They go out in the field, they assess, they input the data on the apps or on the portals. It's a completely paperless thing. But what we realize, that's not the way forward. We should be and sampling exercise. So what we do is a sampling exercise, and that has its pros and cons, right? But largely that is only a snapshot of the quality at a given moment, right? And some hospitals, for whatever reason, they may decide to, for paranoia, for fear, for whatever, they may decide to dress it up. I mean, it's a human culture, right? Human psychology, to create a ideal place on the day of the assessment, which may dilute a day before or day after or some period before or after. That's not a right way. So what we aspire to do is, with use of technology, to gather real-time dynamic data of all the best practices. Our idea is to promote quality, promote improvement. And with that in mind, we have now two solutions. One is a digital health standard, which is totally aligned with the our Honorable Prime Minister's vision of National Digital Health Mission. And we also have the NABH standards for HIS and EMR. So going forward, what we aspire, and it's a vision taking shape, that all software, which is the backbone of any healthcare provider, HIS, hospital information system, or electronic medical record, big or small, whether one module or 70 module or 100 with ERP, with HR, whatever, I mean, bells and whistles, but they all should be incorporated with the tenets of quality, KPI, outcome monitoring. And what we foresee is that in future, not very remote, very tangible near future, all software will be NABH certified and compliant. Already 40 applications have been received. 40 plus softwares, leading softwares of the nation have submitted their this thing. And by next month, middle of next month, 15th of March, we are truly hopeful that our first certificates for software will be given out, and all hospitals going forward in the next few years they are going to submit. Subject to their willingness, we may not even need to send our assessors on ground, or any simple third party like we do Net Promoter Score and other things. They could find out the patient's pulse while we do the outcome monitoring. So there is a lot of surety in what is actually happening, not on a sampling basis, but on a real-time basis. So this is what we aspire to do.
I completely agree with you, sir. And I think if I look at of the little that I know about healthcare accreditation standards worldwide, I don't think any one of those have actually looked at this particular aspect wherein, you look at something specific, you create standards and you largely work on that. So that's a great step that's been taken.
And just to add, sorry, I missed your punchline of the question. The AI and the ML are the integral part of those things. Already QCI is investing a very, very large sum in technology upgradation. One, we ourselves have noticed, like we today, NABH has about 6 portals. Like we grew and there were plugins, and we grew for Hope, then
Right.
entry level Ayush, then new portal, then new portal. So we grew in a haphazard manner, but now our leadership in the right step under Mr. Jakshay Shah, Mr. Kanan, Mr. Rizwan Koita, our chairperson NABH, they've all decided to invest a very large sum to build a one QCI portal. So that is also aligned with the government's vision of ease of doing business. Single window system. Let's say a hospital has a lab. Let's say they have a imaging center. They have a blood bank. So one ID will be given and they can all log in. And along with accreditation or certification, they can get all the nursing excellence and other project programs similar, and data will be pulled from the common pool. So there's the absolute transparency. They'll be less dependence on this thing, outside consultants. There's a e-mitra program coming up. There is a huge repertoire of resources coming in, all free of charge, which we have already built. Chatbot, a very exhaustive chatbot. So what we wish to do and really aspire to do is to put quality into the hands of common people. It should not be disguised or behind curtain or something very complex to understand. So not only our common patients should understand that, which are the actual mover, the next demand, the next push will come from the patient's demand. They'll start demanding accreditation, which they are already doing in metros. But probably in the remote area, they will start to recognize our Q logos and other things. But also any hospital owner, whether a businessman or a clinician, which can, quality is still a complex subject, howsoever simplified we have tried to make it. But even clinicians who read tomes and tomes, they find it a challenge to read or implement a standard. So we have all kind of simplified everything so that we are doing away with the jargon, plain Hindi, English, and 14 total languages, Indian languages we are trying to put everything out in very simple terms. And let's hope sooner rather than later, people will start to utilize this pool.
No, definitely there has been a lot of technology that's been involved as far as accreditation is concerned. And I'm typically or particularly talking about NABH per se, because we have been dealing with or working with closely with the respective office to make sure that, our issues are sorted or whatever communication we need. So I think that has been really very helpful. And we have been seeing on how I'm sure that there are a lot of challenges and a lot of back end work that has been happening, so that we on the other side of the table, we can see, feel, and actually use and experience the kind of technology that's there and is available. So sir, this brings me to another question on, with your largely experience also, an awareness on international accreditation, how do you largely see India aligning its standards and global best practices while also looking at and addressing our country specific or India specific challenges?
So our standards are largely aligned to India, and India is aligned to the globe. At the G20, our honorable Prime Minister had very vocally and very rightly and ably projected one world, one health, one earth, right? So Vasudevaya Kutumbakam. Ultimately, COVID and many pandemics have tried to teach us that we are as strong as the weakest link in the chain. Health is one thing where you cannot get away by creating islands of excellence. I mean, we if we don't care for our neighbors or for the others, we are as strong as or as their weakness, right? So, and that holds true for our country and holds true for everyone around us. So, even in the country, unless we uplift the tier 2, tier 3 facilities, our immunity or quality, that herd quality concept has to come. And I think now time has come for bigger hospitals to adopt smaller hospitals, that hub and spoke model, and for better countries to adopt smaller countries and ultimately work towards this thing. So our standards are very, very popular abroad. We have presence today in 12 countries. They follow our standards. We have 18 facilities. So we are one of the most economical standards to follow, comparable to the already existing standard for such a young body. We have interest from about 8 more countries, and some of the countries, in fact, not only know-how, we are not only our standard and their adoption, we are very keen. For example, government of Uzbekistan is very keen that, and we have offered very frankly that please help us. They have requested us to help them develop their own healthcare standard, which we will be very glad to do, because ultimately it's all for one and one for all, right?
I think, sir, your vision and your comment is so apt when you said that, the larger hospitals adopting smaller ones, or the larger countries adopting smaller countries to improve. I think it's largely we are looking at improvement globally on healthcare quality, patient safety, or general outcomes, learning from each other, sharing our best practices, and kind of really taking it up that, okay, this is my responsibility and I need to do this. So thank you for sharing that comment and your vision largely. So my last question to you, it's been an honor to invite you and to have you at our conferences earlier as well. And we look forward to having you at IPSC 2025 as well. How do you, a conference like this, really, kind of influencing the future of healthcare quality and safety? And what excites you the most about IPSC 2025?
So, Gaurav, I'm a firm believer of interaction. No man is an island. And while published repertory, published resources, webinars, these podcasts, they are extremely important, no doubt about that. But there is something else to meet in person and learn directly from everyone. It's not only the during the didactic talks or panel discussions you learn and absorb. It is from there how people carry themselves. There are subtle nuances, about, and healthcare is one such area where you have to meet people to understand how passionate they are, how empathetic they are, and how evolved they are, and what years and years of their experience they share. I mean, for example, and IPSC is right there where all good conferences should be. And thanks to your astute administration, I think oversight, I think these are very meticulously planned mega events where I truly encourage everyone connected to the healthcare world to join them. I think it's a truly iconic meet, and IPSC has so much for everyone to offer. I mean, you also on the sidelines hold a THIT, so that technology event itself is a window of everything to come. So I think everyone who's who of healthcare quality is there. So the more the people attend, more they interact over those 2 days and the pre-conference workshop. We are also, thank you so much for giving us an opportunity to conduct a workshop on the digital health masterclass. I think that's a truly low-cost gem which people should avail of. And every session of your is filled of IPSC is filled with, I think, hundreds of years of collective experience. So people should avail that, and I am sure those lasting memories they create there and lasting experience is truly worthy of attention. So all of the very best to you. I think I'm sure it is going to be a great event, and I truly motivate and urge people to join in large numbers.
Thank you so much for that, for those kind words, sir. Really means a lot when it comes from someone like you. As I said earlier, we really look forward to having you there. thank you so much for your time today evening to share your experiences with us, your thoughts with us, your leadership mantras that people could kind of gather, understand, and see how we can, kind of take this vision into a larger perspective and see how we can actually make it into a reality as one global team. So,
Absolutely, absolutely, and thank you so much for having me today, Gaurav. But in the end, I would only like to echo what our Honorable Prime Minister also mentioned. In fact, yesterday only, he was at France, and at a AI summit, and he took the example of a medical prescription. When leadership is clued into the technology and leadership is sponsoring better healthcare for all, what better than that it could be,
that's so
then I think it's truly worthy of good days for Indian healthcare. I think, and with all our knowledge capital, our human capital and human resources, I think healthcare world is, I'm extremely optimistic, and clear policy and devotion from everyone. I think the best days of Indian healthcare are there. And accreditation is right in the front and center of it. And I think it's a privilege for us at NABH to take all these things to the last in the line. If we could help improve the healthcare in a small way, supplementing the efforts of everyone, I think we shall be truly fortunate. Extreme gratitude. Thank you so much.
Thank you so much, sir. Have a very good evening, sir. Thank you.
Thank you. Thank you.